Dawn Sagrillo, nurse practitioner with ReFresh Aesthetic Center, excited to share a brand new dermal filler product with you today, Vollure. This is an Allergan filler. We have Voluma and Volbella, and this product will fit very nicely in between those two in treating the nasolabial folds, the lower face, and even the lips. We're very excited about the duration of effect of up to 18 months. What I'm going to be demonstrating today is with Vollure is treatment of the nasolabial folds and also treatment of the lower face. And even in a woman Susan's age who's on the younger end, we can benefit from getting some lift to the lower face, not only by what we do to the mid face, which is very important, but also typically still needing to do a little treatment to this lower face to get that support. Ready to start with Vollure. We use at ReFresh a lot of microcannula technique, which means we have less bruising and a little less discomfort for the patient. Close your eyes, Susan. Feel just a little, might not even feel anything, just a little light pressure. And we're going to place the product. It's a very soft filler, very, very soft. You always want to check to make sure we're not in any vessels. Very good, Susan. You're doing wonderful. Excellent. Moving on to Susan's right side with the cannula. The wonderful thing about these products is they have lidocaine in them, so they numb as we work, which really helps the patient have a better experience during treatment. We've completed Susan's nasolabial folds. I actually only used a half a syringe for her since they were mild, and now we're going to work on this lower facial area to give it support, again with the cannula. Working in the lower face with the cannula, just gently glide the cannula in. Sometimes we meet a little resistance. And this really helps bring the corner of the mouth up too, based on the technique. Very good, Susan. You're doing so well. Taking a different angle with the cannula to give Susan a little more support. And oftentimes where the muscle is tight here inside, it can be a little harder to work with. But Susan won't know that. It's just for us as the nurse injectors. Very good. And it's really important to treat this whole lower area rather than just the corners of the mouth. We lose our support here. Due to laxity, we want to mask some of the pre-jowl region. It really helps. Last area I'm going to treat on this side is the jawline. Again, all to mask the jowl. We just give a little bit of support where there's a dipping in as we age. We just treated with Vollure her left side of her face and her jawline, which was her more difficult side. And now I'm going to go ahead and treat the corners of the mouth, this support area, and along the jawline. Just completed Susan's treatment with 2 Vollure to the nasolabial folds and the lower face as mentioned. What I did recommend for her is to have a neuromodulator treatment to the muscles that pull the corners of the mouth down, as that will give her synergistic benefits to her fillers. It will help it last longer, and it will also complement what we've done with the fillers. So Susan, tell us your experience.
It was great. Even though I have a low pain tolerance, I had minimal discomfort, especially with that technique that you used.
Excellent. Well, I'm so excited for you, and I'm excited for you to enjoy your results.